You know your baby better than anyone. If you think that they are not behaving normally or might be unwell, it is best to seek professional advice.
Although babies cannot tell you when they are feeling unwell, they can display signs and changes in their behaviour.
When you go home, it's important that you monitor your baby's nappy, as this is a good indicator of hydration and also an indicator of good health. It is important that your baby has passed urine, pee, and meconium, which is their first baby poo, and you should let your midwife know if they have not done so by 24 hours old. If their skin turns yellow, which is related to a condition called jaundice, within the first 24 hours after birth, you should contact your midwife or hospital urgently. If your baby is unwell with an infection, he or she may show this in the following ways: being less active and less awake than usual and not responding to stimulation like changing clothes or nappies, being irritable and stiff with a high-pitched cry, breathing very fast for more than a few minutes at a time, or sucking in their tummy every time they breathe in, making a grunting noise, which can sound a bit like snoring when breathing, not feeding as normal. If they appear jaundiced at less than 24 hours old, this may be the whole of the baby's body looking yellow, but it is just as serious if the whites of the eyes, gums, palms of the hands or bottom of the feet look yellow. In any of these instances, if you are concerned about your baby, then please call the maternity unit urgently for advice or 111. If your baby is over a month old, please contact 111 for advice.
Checking your baby's temperature is really helpful when assessing how they are feeling. You can use your hand to feel down the back of their neck, on their back, or down on their chest. As long as you are well and your hands are normal temperature, you will feel if the baby is too hot or too cold. Hands, feet and face will always feel cooler to touch, and you should not worry about this or try to warm them up if the baby is otherwise a normal temperature. If you take their temperature with a thermometer and the reading is 38 degrees or over, or under 36 degrees, and they are dressed correctly for the weather or room temperature, then please call your midwife, GP, or 111 out of hours. If your baby is seriously unwell, they may look a different colour. For example, they might be blue or mottled, floppy when you handle them, or very stiff. The soft spot, called the fontanelle on the top of the baby's head, can be depressed or sunken or bulging and tense. They might fit or be vomiting green fluid. They might not wake up, stop breathing, or have a rash across their body which does not fade when you press a glass against it. These are concerning symptoms and you should seek immediate medical advice by calling 999.